previous attempts to integrate health and social care services in England have failed, with one former health minister telling them there was still a fundamental divide between the two. Alicia McCarthy reports.
Set up a year ago, integrated care systems aim to bring together organisations to plan and deliver joined-up health and care services. 42 have been established across England, and earlier this year, Patricia Hewitt, a former Labour Health Secretary, published a review into their oversight and governance. Giving evidence to a Lords committee, she said what we'd had for the last 75 years was a national illness service, and that needed to change, especially with an increasingly ageing population.
We're also increasingly an unhealthy population, an increasingly unequal one, and one where many, many people are living with lifelong or long-term conditions and disabilities, and all that requires a very different approach.
So there needed to be a shift
from a system that is focused on treating illness, often in its most acute emergency form in specialist hospitals, to one that is focused on prevention and on supporting people to be as healthy and independent as possible for as long as possible.
And Patricia Hewitt argued that meant putting primary and community care at the heart of the health and care system, rather than being seen as far less important than what went on in acute hospitals. But she said while there was good work going on in some areas, the system wasn't set up to maximise integration. Instead, health services were in silos.
GPs, dentists, community opticians, social care, community health, and so on and so forth. Each of those as a separate silo, instead of creating them and making them part of an integrated whole wrapped around patients and communities. That's the big shift we need.
A Labour former health minister, John, now Lord Hutton, said the fundamental divide was between the NHS and social care. He told the committee when he was in office the department tried several ways to bring them together.
Were they successful? I think probably not. We legislated for pooled resources and pooled budgets. It hardly ever happened. It was such a bureaucratic process. It didn't really work. The fundamental divide is one is a free point-of-view service, one is a paid-for service with the means test and people contributing to it. And I think until and unless we resolve that fundamental divide, I think best intentions in the world, and I don't weary anyone's intentions, Conservative ministers, my former colleagues, we're not going to get there.
A crossbench or independent peer and surgeon, Lord Kakar, said it was clear that over the last 20 years, governments had returned to the idea of integration. He wondered why it had failed and suggested
there is no evidence at the moment that the current approach to integration is going to provide the opportunity to substantially remove resources from the hospital secondary care environment and drive them to the primary and community care environment. If that is the case, how, from a political point of view, is this going to be driven forward?
Another former Labour health minister, now crossbencher Lord Warner, said when he was in the department he'd wanted to limit the money going to acute hospitals. He argued it was the only way to make integration work, because otherwise money simply funneled back into hospitals from community services.
Even if you allocated it out of acute hospitals by an amazing osmotic process, when acute hospitals were overspent, the money flowed back from the other services to bail out the failing acute hospitals. And unless you stop that, you can't safeguard the Cinderellas in the community services.
A Conservative former Health Secretary, Andrew, now Lord Lansley, banging the table for emphasis, said he would have liked to develop the system so providers were paid for outcomes rather than activity.
I've never thought it was actually about competition, but it was absolutely about commissioners using their budgets to get the best outcomes. And how are they going to do that? Answer not just by having nice meetings, but by having a payment system which is absolutely fixed on key performance indicators that are principally outcomes, or those processes and targets which are proven, evidence-based proxies for subsequent outcomes.
He argued that was what would drive the system, and that was what we didn't have.
Alicia McCarthy.